Hi, Jen.
Hi, B.
We got another DM that was in response to us asking about the itch, and the woman is about to deliver on Friday too, which we're so excited about that.
Yeah, so this will have already
Aired.
passed.
Yeah.
Yes. By the time this comes out, May 2nd, though, Lauren, thank you
Yes, thank you.
for reaching out, and we are so excited for you.
Her
Really.
response was my whole stomach was super itchy for days. I needed Benadryl cream. I think I was allergic to the prep, which is a good thing to be bringing up.
Yes. So we don't know. Was she allergic to the prep? I wonder if she's going to experience this again. I hope she doesn't. But this is something that my very good friend that I grew up with experienced. She had 3 C-sections and pretty close together. She experienced it after her 3rd C-section. And then more recently, she had to go in for a couple of other surgeries, and she had these horrible rashes each time. So she sent me pictures and she's asking
The benefit of having a doctor friend.
and just, have you seen this before? And hers was pretty severe. I can't remember which time was the most severe, if it got more severe. They're kind of different. I know that after her 3rd C-section, she had, the itchy, the rash, also kind of blisters. I know it sort of spread all over.
And when
body.
did this present? Like when she got home?
In the days following.
Okay.
It definitely wasn't super
Immediate.
Yeah, in the few days following. But it was very bothersome. She had to be on, she tried everything. She ended up seeing dermatologists. She was on steroids, I think oral steroids, and all the creams. You kind of start with the creams, right?
Right.
Same if you get bug bites.
Right.
Kind of same idea. You
Right.
can do cortisone creams or Benadryl creams. And then if you're still having trouble, obviously she was talking to her doctors, and she was put on oral medications, so oral steroids, oral antihistamines, and eventually it went away.
And how frustrating to try to be solving this as a new mom. You're trying to breastfeed, you're trying to sleep. So now this is interrupting any little bit of sleep that you're already getting, and why it's so important that we are going to talk about today what these rashes could be caused from and how to mitigate them.
Yes. I wish I had more answers on how to mitigate them.
Well, I have some holistic things to throw out that honestly are, they are proven.
Yes. Okay. I can't wait to hear that.
Yeah.
So let's first talk about what the culprits are.
Okay.
It seems to me that anyone who's told us these type of stories, they don't really know.
They don't really know, because it's like, was it the prep? Was it the tape? Was it the medication? There are so many. This is a guessing game.
Yeah.
It's Clue.
Well, yeah.
In some regard.
I think you have to look at, it's usually around the incision.
Right.
So it's around the belly. And then if it spreads other places, it kind of starts, there. And we have to think about, first of all, so we're not talking about the actual incision should look okay. Right. And we've talked about that time and time again. Take pictures of it, ask your providers. Make sure that you don't have a fever, signs of infection, fever, redness. Now, a rash could be redness, but looking at the incision itself, it should not be looking angry with pus or drainage or being open,
scent.
Anything like that. Because there are also, infection would be, obviously there's bacterial infections, but also yeast. Those are infections, not what we're talking about today. Different story, but just be aware that there's these different thing that could happen, which is more of a dermatitis rash reaction to something that was put on your belly.
So it came into contact with your skin.
Yeah, it came into contact. It's like a contact dermatitis, allergic dermatitis, irritant dermatitis, but it's a contact type of thing. So a lot of people blame it on, well, prep is one thing. I guess we'll start with that because Lauren brought that up. And there are usually 2 types of preps that can be used. So there's one that's called Chlorhexidine, which is also known as ChloraPrep, and that's that orange one. It's kind of on a sponge, usually colored orange. That is sort of the standard of care one that is better for preventing surgical site infections. So that's the one that you're going to see most often. Betadine contains iodine. That's more of the dark one. That's I don't know what color that is, dark brown color that we had before we had ChloraPrep, but it's still used, especially in emergency situations, because you don't have to wait for that one to dry. When I talk about how after you're getting prepped for surgery and they put the ChloraPrep on your belly And then you kind of have to chill very awkwardly with your arms out to your side and wait for this, I call it soap, but it's this skin prep to dry. That's 3 minutes. And that's because it's flammable and it has to dry before they start using any of their surgical instruments. Betadine is not flammable. So that one, if you're in a superset C-section situation, they can splash it on you and go without waiting for it to dry. But as far as reactions to those, so the Betadine, it can happen, but it's just very low risk, so less than 1% chance of having some kind of skin reaction to the Betadine. So possible, but not. And some people don't know, like you don't.
I mean, if you haven't had a previous surgery, you would know.
Would you know what kind you have? So you can ask, if you've had this kind of reaction, tell me, what type of skin prep did I have? Was it Betadine or ChloraPrep? With ChloraPrep, the reaction's a little bit higher. I saw numbers like around 3%, I would say was the average number that I saw. And that is for, we're not specifically talking about C-sections, that's all surgeries that are using this prep. So I don't really know how to think about that number. But remember, when we're talking about percentages, remember what breech babies were? Something like 3%. You know?
I know a lot of people have had breech babies. Starting with you.
So that's not a nothing number and something to be aware of. So those are the preps. The other thing that people usually blame are the dressings. And you had Steri-Strips, right?
Yeah, I had Steri-Strips and staples.
Well,
so I guess that would be, I think if I thought, I mean, I'm glad I had staples for my last because I felt like my healing was better with those. And I didn't like the Steri-Strips, like that sensation of something on my skin and after like a shower. Did you have to have them anyway? Well, I guess, until I had the staples out. But I meant,
so
did I have them over the staples?
I don't know.
I don't know. Well, I had a dressing on it, so I don't know.
Always have staples?
No, only for Sable.
Okay. What? I don't know. I always forget. I can't keep track.
Well, I can't even keep track. I'm not expecting you to keep track.
At some point you had staples, and at some point you had
Sable was.
You probably didn't.
I think you keep forgetting I had 3 children.
No, when we talked about stitches versus staples, you were like, "Oh, I had staples."
Well,
yeah,
I guess it's more staples. Clear that my staples because it was my last pregnancy.
Yeah. Okay. It's okay. You don't have to remember everything. That's why we talk about things, because it's very easy to forget all of these details.
Totally.
Even if you're pregnant again and going in from 2 years ago, you're like, did I have these strips? Did I have?
But I remember the Steri-Strips because I didn't like them being that wet sensation on my skin made it feel like it was going to be irritated. And I do have sensitive skin. I know that about myself.
I didn't love them either. Yeah, so this is a good opportunity, I think, to go through those options.
Yes.
So when they're closing, everything's closed on the inside, then they're going to close your incision with either staples or subcuticular. Again, I'm not a surgeon, so please take everything with a grain of salt, but this is basic knowledge type of stuff, where the sutures are usually absorbable and they're kind of, you can't really see them. They're just right underneath your skin. And then you might feel a little bit of, they tie them off at the end of either end of the incision. So sometimes people do see something poking through at the ends of your incision. And I don't think with staples you would need anything as far as glue or Steri-Strips. I believe that's just with the sutures, but I can't be sure. Could be wrong.
And I can't be sure either because I have home brain.
So check with what you have. But this is just to know what the different things are, so then you can go and say, what did I have last time, or what am I going to get this time, so that I can understand my risks of various things and how it's, just feel more prepared and comfortable, right? That's the whole point. Then you might have something on top, like a gauze pad.
Yeah.
So if you have the sutures, you're going to get either the Steri-Strips, which is what I believe you and I both had when we had the absorbable sutures, or the glue, which is newer. It's not, I see it more with C-sections than I did before. And that's essentially like we've all, at this point, if your kid falls and they can, instead of
I have it at
putting
home.
a stitch, you glue it. They do that also to sort of protect it, more of like a barrier kind of effect, and keeping it closed. And then usually on top of that, it will be like a gauze pad. And then you have to tape that gauze pad down with sometimes silk tape. There's all kinds of fun
Different
things.
tapes,
They have these giant tegaderms now
Oh,
that are
yeah.
so fun to like pull
Pull
off,
off.
stick down. They look really pretty. So there's gonna be something else too. So all of these things have been on your skin and could potentially cause some kind of hypersensitivity reaction or contact dermatitis picture.
There was a lot of chatter about the tape.
About the tape.
About the tape. Everybody was like, I think it was because of the tape.
Like the Steri-Strips, are they calling the tape? Or the tape covering?
I think the tape covering.
So that is on usually just for like a day, right? And then they take it off. So they're checking it to make sure there's not any bleeding coming through the incision. But that usually comes off. But still, yeah, adhesives is the other thing. So one would be the prep. And the other I think you can put into the general category of adhesives.
There you go.
Which might be, go from top to bottom, the tape that they put around the gauze pad or type of CBD pad, whatever it is. I think if you had that, it would be pretty clear.
Yes, I think that's what it was. Like you could see the line of like where the tape was.
This is where the tape was, and this is where my skin.
So the benefit of it is at least you can get to that part of what caused it versus being frustrated by what is causing this and how do I stop this rash from spreading or this irritation to keep continuing.
Yeah, and I do see this pretty commonly where people come in saying that they have some sort of tape allergy, and they usually know about themselves that they don't do well. Like they usually like paper tape better because we have all different kinds of tape. So there's silk tape, paper tape, tegaderms, and most people who have experienced this, they come back and they tell me, can you use the paper tape for, and you're going to have tape in a lot of places.
I was just going to say that you can also do a comparison.
Your IV.
Yes.
Yeah, so your IV, anything covering your incision. If you had an epidural, they would potentially tape the epidural to your back. So I have seen that where for a C-section, I don't go crazy with the tape because I know I'm taking it out afterwards, but I might put a big strip, long strip up your entire back and you pull it off and clearly you have sensitive skin. Yeah. And this has caused some kind of irritation.
So who are you talking to if you have sensitive skin, this going into your surgery?
Your nurse first, because you first might encounter this with your IV placement. So usually if I don't hear it directly from the patient, then I will have heard it from the nurse who heard it from the patient when they were putting the IV in as far as what type of, how they want to secure the IV in place. So I would say nursing and anesthesia. And it's nice if you know what, from experience, I react with this or I don't react with that. Those are not, they're important, but I would say they're not really these situations where it's like days and days or months of needing all of these extra medications and stuff like that. That is usually going to be more from what I've saw in my research is that glue was a very common one. The glue in lieu of the Steri-Strips.
Causing an
irritation. Something, up to 10%, but something around 5%, it seems, with C-section moms when they use the glue. And that may be this debate that the OBs have. Again, this is not my area of expertise, and they do what they're going to do for their reasons. But perhaps that's why some, after seeing a few of these reactions, are now
shying
going
away
back
from the glue.
So, right. Whereas like Steri-Strips all day long. And then I saw this move towards the glue, and just anecdotally, I'm seeing a move back towards Steri-Strips, and I'm wondering if that's part of it. The Steri-Strips can cause the reaction, but much, much less common. The thing that the Steri-Strips can cause, which I think is you were sort of alluding to, is just that irritation when they're kind of dried up and rubbing against your skin. And if there's a lot of moisture that gets kind of caught underneath there, that can be uncomfortable and obviously irritating.
That's why you take the hair dryer and you dry it.
Yeah, or like trim them, or ask your OB. I don't know. I don't want to tell anyone to do anything, but
I'm giving a suggestion. It helped me.
You blow dried it.
I blow dried it with cold air. It felt so soothing because also as you're healing, you are itching. That would be a normal finding to the skin healing, but it's still uncomfortable.
Yeah.
So then top on a rash on top of that, now the layered effect is coming.
Talking from a personal perspective, I found the instructions as far as what to do with the Steri-Strips to be extremely confusing. I mean, I had heard this told to other patients time and time again, which is, oh, they're just gonna fall off, and that's it. And when they fall off, don't pull them. And so I was being my good patient. I was
Following
like,
the
I'm not gonna
rules.
touch them. I'm not gonna pull them off. That's gonna give me a better. And here I am, week 3, week 4.
Pull them off?
How long are these things? They're like getting disgusting.
Did you ever pull one off?
I think eventually I did. And then there was still some at my 6-week appointment.
I know we had talked about this before. Yeah.
She pulled them off then. But now looking back, I could have had those suckers pulled off way sooner.
Which is why the 2-week mark to go in and see is so important, because then you can get in front of this before waiting those additional 4 weeks.
And yes, it's just a little annoyance, but let's just...
Those annoyances matter.
Yeah,
if it's
they add up.
They do add up, and you're already like irritated, and you're already tired, and you're already trying to bond with this new baby, and like that doesn't just come naturally. Bonding does take some time. So if you have anything else that's irritating you, it's a big thing.
Yeah.
It is a big deal.
Yeah.
That's why we're talking about this.
Yeah. So yeah, I would really want very clear instructions. I mean, I would very much push for that 2-week appointment for many reasons, but one being they can take a look, see, have any fallen off? Have none fallen off? Can we take them off? Can we take some off? Because they are irritating.
Yeah, for sure.
For sure. So we have the Steri-Strips and the glue, and we talked about the glue is the one that tends to cause that more severe with the blisters. And this was kind of interesting. I think for all of these, but for the glue in particular, when people have been exposed previously, that's when their risk of having this type of reaction increases.
Interesting.
And for this glue in particular, it's made of something called 2-octyl cyanoacrylate. But if you listen to that, cyanoacrylate allergy is something that you can look up. It's sort of related to with acrylic nails. So some people, I guess, react to acrylic nails.
Interesting.
Are people still getting acrylic nails?
I don't know. Apparently so.
I don't know. But apparently,
that's so interesting.
If you've had a reaction to acrylic nails, that is something to be aware of because you would most likely react to the glue.
Can I just have a really quick side note? So Sawyer actually keeps asking me for acrylic nails, and I'm like, where did you even hear about?
She uses the word acrylic.
She says acrylic nails. Where did you hear about acrylic nails?
You can have some stickers.
I have the stickers. It doesn't count.
She's already been using those for years.
We're there. But it is funny. Maybe they are having like a rebirth because she's talking about them. She's seeing them on TV or something. It's coming her way.
I just got my nails done for the first time in I think a year.
Can I look at them?
They don't even, I mean, they don't look amazing. They look better than they did, though.
But how do they make you feel?
They make me feel great.
That's what matters.
And it's because the weather's warming and
yes,
I need
people are going to see your feet.
Yeah. But anyways,
back to rashes.
That's just interesting if you know you have that kind of reaction, or maybe if you've been doing acrylic nails for a while, I guess that's something that could have sort of primed your body for
be more
a repeat exposure causing this type of reaction. And also it's interesting that with my friend who had this terrible rash that it
was it from the glue? Did she
never got an answer. She was told different things each time, and she's ultimately been told probably you react to more than one thing, because I think they tried to switch one thing up and then she still got it. And I don't think they've switched up every single thing, but they think there's probably she's probably the Steri-Strips. I know she did have one with just Steri-Strips where she had the reaction, definitely with the glue. And now she's wondering about the prep too.
Yeah.
So I'm going to ask her, I don't know if she's had any kind of testing done, but you can go to a dermatologist if this is something that was really severe for you and get patch testing.
That's a super smart thing to do.
Yeah.
Especially if you have super sensitive skin and you have a dermatologist that could do any type of workup prior to your surgery. For sure, add that to your list.
Yeah.
At that point, what's one more doctor's appointment?
If there's something that can be avoided.
Yeah.
So for example, we talked about, do we need Steri-Strips or glue?
Yeah.
With either stitches or staples? If one of those or both is causing this reaction, is there a way? What are the risks and benefits, I guess, of avoiding that completely?
Yeah.
Do I absolutely need that?
Very good question.
You know, it's a good question to ask. I mean, I think that there's probably a way to avoid one of those, whether it's just by doing the staples or I don't know.
Yeah.
There's got to be some other option than the adhesive directly on
For
the
sure.
incision site. And then prep 2, what are the risks and benefits? Like I just said that the ChloraPrep is known to be superior to the Betadine, but not by such a great degree that if you're reacting to it.
Well, yeah, because a lot of the chatter was
Yeah.
it lasted for like 4 to 6 weeks, which was obviously incredibly frustrating. And a lot of like the OB said one thing, sent me to a dermatologist, creams, orals, like nothing seemed to just help
Cut
it. It just like it was just like a constant.
Almost
They were like
time.
very tiny, but all over from the abdomen to the
And the
like the
legs.
legs, like down to like one of them was like basically it was like almost to my kneecaps.
Yeah. So I think another thing just to look up if you're looking into this is allergic contact dermatitis. And there's a lot of burning pain with it too, and sort of spread all over. And the key point is if we're comparing all of these itchy things, I think that your incision itself should look okay. And if it's involving, and especially if this is a glue reaction, then it might not look okay. Like that needs to be ruled out, that it's not an infection of some kind, that it's more of a allergic reaction. But also the time course, you know, comparing to the itchiness we talked about last week when we were talking about opioid-induced itching, that really happens very shortly after you get usually spinal or epidural anesthesia, whereas this is something that tends to develop at least, you know, after a day, but sometimes it can be delayed 5 days before anything really crops up.
Now you're at home trying to problem solve this on your own or reaching out to your doctor, trying to get in for an appointment.
Another reason to just have a standard 2-week appointment for everybody.
Yes, so true.
I hope they do that now.
I think it's trending that way. I'm actually going to ask my cousin who just had her baby via C-section.
Or anyone who's listening, please reach out to us and let us know if you did not receive a 2-week appointment and we're just still waiting for 6 weeks. I really, really want to know about that.
I'm curious to know too.
What else, B? Do we have any stories? Oh, tell me your remedies.
I know. I was just going to say, give me my remedy moment.
We are clinical with a side of crystal, medical with a side of crunch.
I'll throw it out there all day long.
What are the other ones?
They're so good. We looked up on ChatGPT basically how to describe our relationship, which is medical and crystal focus. And
there's a lot of good ones.
ChatGPT really gives us a lot of good ones back.
Hilarious.
Okay, these remedies I love too because they don't cost a lot of money. And, you know, I like to always prep ahead of time. So we talked about before in our last episode, having a spritz bottle. You can just put some filtered water and put it in the fridge so it gets super, super cold. So if you are experiencing these little rashes, hopefully water is not going to further irritate. Could be a little drying to the skin. So, you know, also maybe having an oil or a lotion that doesn't have any fragrance in it. And really, I feel like just stay away from heavy things with fragrance when you have that new baby too, because the baby's skin is super sensitive as well. So having a little spritz bottle, at least it will help confuse your mind for a little bit, and those signals of like itch, 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 itch are not being sent. And there's that moment of just soothing relief, I guess. So buy that spritz bottle ahead of time. You can do it on your face too. You can wake yourself up at 2 a.m. when you need a nurse again. Having a gel ice pack, I think, is something everybody, I don't care if you deliver vaginally or C-section, have one of those large gel packs. You will find a lot of different places that you want to put that gel pack. But especially if you have a rash on your abdomen, you could put that on there and that would be so soothing, especially if it's gone down to your thighs or anywhere.
This would be a cool pack, right?
Like a gel pack. You know those ones? Like it's not, they don't get too
put them
cold.
in the fridge.
Put them in the freezer, but they don't get like as cold as if you had like a piece of ice on you or something like that. I'm a big fan of gel packs. Also, vitamin C is an antioxidant. So having a diet that is high in vitamin C. Again, if you're getting a lot of like, I don't know what the rash is, I don't know how to help mitigate it. We've given you all the topicals, the orals. Increase your vitamin C intake. I'm a Florida girl, so I don't know if this was always thrown at you. Aloe vera all day long.
Yeah.
I mean, my grandfather would be like, go out to the garden and get some. He would chop it up and put it in our water. I don't think we actually consume enough. And actually, I think worldwide, the consumption of aloe vera is used at a much higher level than we do in the States. And it also helps us absorb vitamin C as well. So with the aloe vera, you're getting your 2-for-1 of you can soothe the skin with something super natural, but it's also helping our vitamin C intake.
All
I think
right.
I might be forgetting one,
Oh, goodness.
but I
Do
think
not
that
forget anything.
yeah, no, I can't. No, those were those. Those were those.
So your itchy
Those remedies.
remedies. I'm
And
surprised.
cost effective.
I'm
Like
surprised I haven't felt more itchy talking about this.
I just started itching my neck
I think I
actually as I
noticed.
read the aloe vera. But I think also too something that felt in the chatter that felt very frustrating that everyone's like, I just wanted to feel that somebody was addressing this and giving it the weight of how annoying it was to have this constant itch and to be told, I don't know what to tell you is not a response anybody wants to hear. So keep asking questions, keep finding, maybe you have to go and find your own products and going back to like the skin patch test. If you find a product that you might want to use, try it. I mean, I don't know, I don't think aloe vera would cause an issue for someone, but try it on an unaffected area where you don't have a rash before you put it on that rash might be helpful too. If you have very sensitive skin and you're, just wanting to be extra mindful.
I think in general, if you're getting a treatment plan, let's say they don't know what it is, but they say, we're going to try this cream and this medication. I would say, okay, how long do I wait to see if we can count this as working or not? And then what is our next step if this doesn't work? So should I wait a week? And then if after a week it's not better at all, then what's the next plan? So that you could keep on top of it, just be cognizant of where you are in the process. And if you don't have a diagnosis, at what point should I be seeking a diagnosis? Is it possible to get a diagnosis? What kind of testing can I do? So if I am going back again for another birth or another surgery, honestly, it could be any surgery, I can be more prepared and understand more about what happens to myself so I can then give that information to my next medical team.
Well, honestly, that's why the one response that said, I'm like nervous to get pregnant again because the itching was worse than my C-section recovery. So again, give it the weight that it deserves. If it is causing if it is becoming something you are thinking about to that level, you have to address it and you have to bring it up to your providers or anybody who's going to be around you because it matters that you are not feeling this way going into your next surgery.
Yeah. And I would definitely tell that to people. Yes. Don't be afraid. This is driving me crazy. This is making me so upset that
this is you advocating for yourself
to even ever have to experience this again. So I really need answers.
Yes. Yeah. Keep pushing. Also, I think it's going to go back to having helpful people in your home because if you are experiencing something like this, you can say to somebody, can you go get me a cold washcloth to put on this rash? It's driving me so crazy right now.
I forgot about the cold washcloth.
I forgot what. But seriously, like even if you don't have that gel pack, take away any extra irritants in your house and having people around you who are going to be helping you manage all of these pain issues, itching issues, just feeling overwhelmed because we all have felt that way. And having those safe people around you, I cannot highlight that enough always.
I think that's just come up with another question to ask the provider too, is what are some other non-pharmaceutical things I can do, whether it's steam, hot, cold, environmental changes that I can make, make sure that you've gotten their advice on all of those because they may have something for you that they just didn't think to tell you that's not a pill and not a medication that you can just throw everything at this. And even if it's just for comfort, if it's something that's not going to fix this rash, you need the steroids to fix the rash. But in the meantime, what can I do for comfort?
You can also go back to your coping of deep breathing exercises, especially if this is becoming like a real psyche thing for you. Go back to these tools that will help calm you, the deep breathing, having some calming music, whatever it is that helped you in other moments of not being able to cope, go back to these. These are tools you can just keep reusing. I deep breathe every single day, multiple times, dealing with someone cutting me off, dealing with my kids yelling at me, telling me something I don't want to hear, whatever. You have to just keep utilizing these tools.
Stay calm.
Yeah, stay calm.
Because itching is crazy. When your kids get head lice, this is also bringing up for me. And so then all day long.
Do you remember when I got that crazy rash on my neck last summer? No, it was actually 2 summers ago. Yes. So obviously this wasn't like pregnancy related, but I can empathize. I don't know. See, so what I empathize with is nobody could tell me what it was. So like finding treatment was so frustrating. And two, even covering it because it looked so wild and I didn't want it to keep spreading either.
Bethany, yeah.
I was even scared to put tape on it. Honestly, I was like, I don't know what to use because I was just so panicked that I was going to do something that was going to further irritate it. So if you have experienced these type of rashes, I empathize with you so deeply because it interrupted every second of my life until it went away.
It was gone, yeah.
I mean, I had to go to parties and people were like,
I remember when you came to one with like,
I did the patch.
I was like, what?
Like the gauze.
Did you get into a serious accident?
I'm like, I just have this rash on my neck. No, I don't know what it is. And no one can tell me and it won't go away. And it lasted 4 weeks. Anyways.
So we empathize and we hope none of you have to experience this. But if you do, we hope this gives you some clarity, some questions to ask, some things to consider.
And if you did experience this and you found a good remedy that was helpful, please let us know because we can continue to pass this information along to our audience of things that helped you.
Yeah.
Holistic, send it my way for sure.
Yeah. Medical, send it my
Yeah.
Thank you so much.
Thanks for joining us.
A reminder again to check out our free C-section guide to help you prepare for an upcoming birth experience, if that is something you are doing by listening to us. It's a great opportunity to think about all of your options, who to go to. You can find it. There's a link in our show notes, or you can find it on our website, csxpodcast.com.
And we can't forget to say Happy Mother's Day.
And Happy Mother's Day.
We forget to say this at the beginning.
Ooh, this will be after Mother's Day.
Oh, well, we hope you had a great Mother's Day.
Happy Mother's Day.
And if you didn't get something and you need to celebrate yourself, take 30 minutes to be by yourself. That is a gift.
Absolutely. Happy Mother's Day.
Happy Mother's Day.